Hello, I'm Ken Roberts, and I'm a public governor for South Central Ambulance Service, or SCAS. 5 people die with sepsis every hour in the UK. And 40% of all sepsis survivors will suffer permanent, life-changing after effects. I'm joined in this short film by Mark Ainsworth-Smith, MBE, who's SCAS's consultant pre-hospital care practitioner. And we're going to explore this serious condition further. So Mark, what exactly is sepsis?
So the definition of sepsis is actually really complicated. There's literally dozens of those, but probably the best one is sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. Well, as you can see, that's probably the most simple one that we've got, and that is really very complicated. Martin Kim, who's the National Clinical Director, came up with a much better definition, and that's infection with badness. Some people will get an infection and most of us will actually be fine. We'll heal and we'll be completely back to normal. But in certain people, unfortunately, they get this dysregulated response which causes almost like an autoimmune type issue. So they become very, very unwell with low blood pressure, shock, and unfortunately that can cause real problems in terms of death.
Are any groups at particular risk?
So potentially anybody can develop sepsis, and we need to remember that, and none of us should let our guard down. The high risk groups are those, particularly the patients aged over 75 years of age, but also children, very young children are vulnerable, particularly those that are less than 1. The other group of patients is those that have been exposed to trauma, so for example had a road accident. Those are very, very vulnerable, and that's because often they have fractures, etc. Another group of patients that we always worry about are those that are immunosuppressed. So for example, patients who are on immunosuppressants, those for example that have had their spleen removed in the past, and very particularly those that are on chemotherapy. Anybody on chemotherapy needs to be extremely cautious and try and do everything they can to protect themselves from infection.
How would anyone recognise or suspect someone has sepsis?
So generally there's a sign of infection. That could be a urinary infection, a chest infection, perhaps a skin infection. But unfortunately in some patients they then become very unwell, and this can cause them to present with all sorts of different symptoms. One of the common ones is feeling feverish and then developing chills. So we even get calls to people fitting because they're shaking because they're so cold. So that's probably one of the most common. They may have a very high temperature, but paradoxically they may have a very low temperature when they become really very unwell. Their blood pressure will fall, their heart rate will become relatively quick, and they will become really unwell really quickly.
What should anyone do on suspicion of sepsis?
Anyone with signs of infection should be very alert to sepsis. As I've mentioned, most people will recover without any issues at all. But if anyone develops any symptoms such as a high fever or feeling really unwell, really shivery, then absolutely they need to take that seriously. And what we'd recommend that they do is contact their GP, phone 111, or if they truly think they've got sepsis, that is an emergency and it's perfectly appropriate to phone 999.
How would SCAS confirm that a suspicious case is indeed sepsis?
So we've done a lot of education with our staff to help them to recognise patients with sepsis, and the key message here is to go in with an open canvas and treat everyone as though potentially they've got sepsis. Once we assess a patient, we'll have a look at their blood pressure, their heart rate, their temperature, their blood sugar. We'll look at all sorts of parameters, but we have a system called NEWS2. NEWS2 stands for the National Early Warning Score, and it's version 2, which is absolutely the most up-to-date. Indeed, SCAS were the first ambulance service in the UK to use NEWS2. This is a scoring matrix that scores people out of 20, and the higher the score that you have, the more unwell you are. For patients that have a score of 7 or above, we know that they are at extreme risk of potentially needing intensive care, and all of those patients will be conveyed to hospital. If patients have a score less than that, then again we have different parameters there and we can decide what to do, and some of those patients, particularly if they don't have signs of sepsis, may be suitable to stay at home under close supervision from their GP. But the vast majority of patients who do actually have sepsis will end up being transported to hospital.
How would it be treated?
So once we've assessed the patient and found they potentially got sepsis, the main thing we're going to do is to transport those patients to hospital as quickly as possible. There's some really good evidence that the earlier patients get antibiotics, the better it's going to be in the long term. They'll need to stay in hospital for a shorter time. Our ambulance crews do carry antibiotics, not for sepsis, but for example for children with meningitis, we absolutely do have antibiotics and we will administer those at the scene. But what we'll do in a pre-hospital setting is we will package our patient, give a pre-alert, which means that we'll warn the hospital so that they're ready and often even have antibiotics ready, and then we'll transport that patient, often under blue light conditions, directly to the ward or the emergency department where they'll receive absolutely brilliant care literally within a few minutes of arriving at that hospital.